At the Lymphoma, Leukemia, and Myeloma Conference, I was given the opportunity to present an update on the work that has been done to target a specific chromosome translocation in multiple myeloma. Of course, the background is critically important, and that is where we talk about the history of the discovery of the specific genetic subtypes of myeloma, with a particular emphasis in the chromosome translocation T1114. The T1114 was the only translocation that could be identified originally in standard karyotypes, and subsequently was carefully mapped by my colleagues Dr. Bergsago and Martha Kessie. We went on to describe the clinical features, attributes, and outcomes of patients who have this specific translocation. And originally, it was thought to be a good prognosis translocation, but unfortunately, as time went by, the progress that we were making for the treatment of myeloma at large didn't seem to be as great as it was for other tumors for the patients who have this specific translocation. Now, we've learned also that this group of patients seem to have a different form of myeloma. It's myeloma that's a bit younger, if you may. So it's myeloma that express lymphoid markers. The cells are less mature. They have more scant cytoplasm. And importantly, they signal through different anti-apoptotic signals. Very specifically, patients with a translocation 1114 favor signaling through BCL2. Now, this is in sharp contrast to most myelomas where the signaling is through MCL1. And the good news is that we do have inhibitors for BCL2. The prototype for this, of course, being Venetoclax. So I had the opportunity also to do an update regarding the treatment of myeloma with Venetoclax and the special emphasis that is being placed on this being applied for patients with this translocation, and literally with just very, very good results. So we're hoping that this would be the first of several other ways by which we can do a more targeted or a more precise approach for the treatment of myeloma. But we already see the harvesting of the first set of results that would indicate that as we figure out the other signaling pathways and mechanisms for the rest of the genetic subgroups, hopefully there is a future where we have specific targeted agents like we do now with Venetoclax for this subtype of the disease.